Morning, everybody, and thanks for joining us one more time in our weekly Facebook Live in our Texas Latino Conservatives Facebook page. Today, we have a very, very important guest join us, but we have Orlando Sanchez from Montana. Orlando, how are you?
Hey guys, how are you? From the Paradise Valley here, just north of the Yellowstone National Park on the banks of the Yellowstone River. So it's a little cooler, I'm sure, than it is down in Texas, but it's welcome. It was about 34 degrees last night. Hopefully it'll get to about 60 degrees today. So Dr. Packard, thank you for joining us. Andrea, I'm going to toss it back to you.
Thank you.
Well, Orlando, that looks beautiful. Yes, here it is very hot and humid. Over there looks amazing. Well, I'm here with Dr. Stanton Packard. He has been practicing medicine for 27 years. And today the topic is telemedicine, something that it already exists, but with COVID-19, it become more popular. And we're going to see that this is going to be very expanding. And so we have Dr. Packard explaining to us what is telemedicine. But before we go to our topic, Doctor, well, welcome.
Thank you.
Thanks for making the time to be with us here in our Facebook Live. And first of all, let's start with a little bit of you, your background. Where did you graduate?
Well, thank you so much for having me on the Facebook Live today. I'm so happy to be here, and I love the Latino community. And it's un idioma que quiero mucho, and it's a culture that I love as well. So, so I was raised right here in Southeast Texas near Beaumont on a farm, and I'm the second of 13 children. And my father was an attorney in Beaumont, and I went to medical school. I went to college in Beaumont first and graduated there, 2 hours from Houston. And then I went to University of Texas Science Center, Health Science Center in San Antonio, and that's where I got my doctorate degree. And from there, I went into emergency medicine, and I loved emergency medicine. I still love it. I'm addicted.
And you said that you were 15 years in the emergency.
Yes, but I worked double time, so it's like I did it for 30 years, but it was all crunched into 15 years. It's like a car. It's more about the miles than it is the years. So I got a lot of experience there, but because it was taxing on my family, I have 8 children, and my wife and I made a decision to just kind of move into family medicine and spend more time at home. And in the process of doing that, I moved to Houston, and I began to notice that I gravitated to the Latino community. I love them, they love me, I spoke their language, and I didn't like being in hospitals, so I liked the primary care setting in the office, and that's just what I decided to do. As it started in Pasadena, there was another clinic that wanted my help, and I couldn't be in both places.
So when you're talking about the Pasadena, is already the telemedicine or just the regular clinic?
It started as a regular clinic. But where the telemedicine came in is something that I learned back in the emergency room, way back when I used to work up north of Amarillo. I worked emergency room all over Texas, from Amarillo all the way down to the valley, and from El Paso all the way over to Beaumont Orange, Golden Triangle. So north, south, east, and west, and in the middle. And I learned, it happened to be when I was in Amarillo and Dumas, something called telemedicine. And this telemedicine basically means when the doctor and the patient are not in the same room, when the doctor cannot be there, but yet wants to take care of the patient. So that it's not just a conversation. Hooked up to the computer system is a stethoscope. So we can put the stethoscope on the patient's heart, and the doctor can listen to the patient's heartbeat from far away. Also, you know that little light that they shine in your ear?
Yeah.
They can do that with fiber optics, and the doctor can see inside the ear. You can say, open your mouth, say let me see your throat. Oh, you have tonsil problem.
Oh, wow.
You can listen to your lungs, listen to your heart. And with cameras, you can look at that rash, look at that dog bite, look at that bump on your skin or wart or whatever you got. Now, there's some things you can't do, like you can't deliver babies over the internet.
Yes, of
You
course.
can't do big surgery over the internet, but little things we can do. And in the family practice setting, we figure about 80% of what's done in a normal office can be done in a telemedicine setting. And about 20%, we just have to say that's not proper.
So we can have Orlando in Montana, and somebody can examine Orlando here, right? Orlando, what do you think about it?
Well, I think it's actually a very important topic to discuss, especially during this outbreak of this virus, because as Dr. Packard may recall, in our brief meeting, I told him that I was a property owner in one of the poorest rural counties in Texas, known as Kinney County. And we are located between Uvalde, Texas, which has a small regional hospital, and Del Rio, Texas, which has a small regional hospital. But as he knows, neither one of those are level 1, level 2 trauma centers. So we're literally a 2-hour drive from San Antonio. And one of the issues that's very important to me and the Texas Latino Conservatives through our nonprofit is the comorbidities, particularly in the minority community and among Hispanics. We know now that the data is indicating that if you have underlying conditions like heart disease or diabetes, hypertension, that you're at higher risk for complications from COVID-19. So I think it's important going forward that citizens in rural counties in Texas understand that technology is the way forward to bring medical services to these communities. Am I right, Doctor?
Absolutely, Orlando. You're spot on. Telemedicine started with the video conferencing alone, just with psychiatrists trying to visit their inmates in the Galveston prisons.
Oh, wow.
Because they didn't want to be in the same room as the inmates. But then later on, family practice picked up on it and added the stethoscopes and the other implements that the psychiatrists typically don't need. And it became full-blown diagnostic tools. And yes, it was especially used in the rural communities where patients don't have access to medical care except by driving great distances.
One of the things
go ahead.
I just simply wanted to say, I think it's fascinating. You know, back in the 80s, I was a volunteer emergency medical technician in East Harris County. And one of the fascinating things in the ambulance was telemetry. In other words, we could communicate with the ER en route. And I always thought that was fascinating. And I always thought to myself way back in the 80s, why can't we use this to reach people in remote areas?
And here we are. So that was great. You had that vision. And here we are today. So it has evolved to where at first it started in the prison systems, but then when it dealt with medicine, it began at first mostly to talk between one doctor and another doctor. Okay. And like a family practice doctor talking to an orthopedic surgeon about a bone issue, a specialist and a general practitioner discussing a patient. And this is telemedicine. But it was actually permitted, as we researched the law, to have any presenter who has a certificate of anything in medicine to present a patient at his side to any doctor or nurse practitioner or PA who's remotely located.
Yeah.
For example, Andrea, if you were my patient, and let's suppose Orlando was the doctor far away, but let's suppose that he was licensed in Texas. He may not be in reality, but this is an example. I could say, Dr. Orlando, I have Andrea, a patient of mine, and I know you're far away, but you're licensed in Texas. I want to tell you about her. I'm the presenter, and I'm presenting a patient to a faraway doctor.
Okay.
And the doctor could say then, okay, Stan, would you please put the stethoscope on Andrea's heart? Let me listen. And I will let you, faraway doctor, listen to her heartbeat, look in her ear, look in her mouth, or whatever her complaint will be. If she comes in complaining of a big toe problem, probably we will not look in her ear. But at least you have the options, and the doctor makes the choices. So this began with us. We began to use this in a primary care setting about 5 years ago. And we were among the first doctors to begin to use telemedicine for primary care when the doctor's not in his office. And the reason we did it is to reach all of the Hispanics that were out here, and there was just not enough doctors to go around.
And they didn't have insurance, because that's something very important. You know, many Hispanics are not able to pay the big amounts of insurance, and also, but they can go to a doctor without paying giant amounts.
Exactly. So an average doctor fee cost about $30. You go in there, it's cheaper than a lot of copays, and it's very attractive to the Hispanic community because sometimes they don't have insurance or they're underinsured. And the one doctor now, like I'm going to be the doctor, okay? So like if I'm servicing clinic A in Pasadena and the other one in Katy and another one in San Antonio and another one in Dallas, but none of those clinics are very busy, one doctor can do for all of them.
Correct.
So I will answer this one, and 5 minutes later or 10 minutes later, I might answer one in Dallas. What this means is the doctor's fees does not have to be paid 4 times at 4 different clinics, which drives the price of the visits down, and it saves the patient's money.
Yeah,
It's very
totally. So
interesting
you
to
guys
me.
started in yeah, Orlando, go ahead.
I like the affordability and the accessibility, doctor, and it makes a lot of sense. One of the, from a public policy perspective, it's my understanding that there were laws or statutes in the state of Texas that the first visit had to be a physical visit, which limited the ability to have telemedicine in rural areas, because a lot of the folks in rural areas may not want to drive to the doctor. It's just an inconvenience. A lot of people don't even have vehicles to get to a doctor. Is that still the case, or is it the case now that you can just contact your clinic virtually and have an initial visit with you for a diagnosis? Because a lot of times, particularly young kids in rural areas may have bronchitis, but going untreated, as you know, can develop into pneumonia and more serious things. And if had they been treated in the beginning by a physician and be prescribed potentially, I don't know what you prescribe, I'll let you talk to that, but you can prevent more serious complications. Is that right? And so I want to know, can you have an initial visit virtually rather than having a physical visit?
Yes. That has not always been the case. A few years ago, Governor Abbott and we had a conversation, and that was his question. Can you establish a doctor-patient relationship on a telemedicine visit, or does it have to be an in-person visit? And my answer was, it has to be an in-person visit according to the law, but we're hoping that can change, because truly, telemedicine is sufficient for a doctor to get to know, especially with all the technology and everybody's talking on FaceTime and chats, and it should be where a doctor can get to know his patient for the first time and establish a relationship.
What year was that legislation? What year was that legislation passed that allowed you to have the first initial visit virtually?
I believe it was 2017.
So this is relatively new.
It's relatively new because heretofore it had to be like Andrea and I in the same room, what I call a tangible visit, in person, where the doctor could examine the patient's abdomen, mash on his abdomen, and do a typical physical exam. And that was required to start a doctor-patient relationship, and then subsequent visits could be done by telemedicine. That changed a few years ago. I think it was 2017 or thereabout. And it basically said that the first visit still has to be face-to-face, but they changed the definition of face-to-face to include telemedicine.
Excellent.
So a face-to-face visit is either an in-person visit or a telemedicine visit.
Mm.
And that establishes a doctor-patient relationship. Now, let me say something else. When COVID-19 hit, Governor Abbott did a wonderful thing and announced that doctor-patient relationships temporarily in this crisis may now be established by phone only, if that's all that you have. If the patient's in his house or her house and can't make it to the office where our telemedicine equipment
To
is
the
all
clinic,
set up,
yeah.
they can call and the clinic can three-way to the doctor who might not even be there, and have a three-way call between the
Wow.
doctor, the medical assistant or nurse, if there's a nurse, and the patient who might be in the patient's house, and a doctor-patient relationship is established. Now that's very new COVID-19 stuff, and it's probably temporary.
And we don't know if it's probably temporary or it's going to be the new normal.
Could be.
Because COVID-19 it came to change many things that we thought that it were never going to happen. Doctor, very important question, or different questions.
Yes.
So you guys started in Pasadena
Yes.
with these clinics, then expand to San Antonio and Dallas, and then go little by little to rural areas.
Right.
How many clinics you guys have right now, and what is the percentage of the Latino population in patients that you have in the clinics?
Okay, let me clarify first. We do not own most of the clinics, maybe a few. Most of the clinics that we service are owned by independent doctors.
But they get your service.
And they subscribe to our
Yeah.
service. And sometimes there's a clinic that doesn't even have a doctor in it. In fact, usually the most expensive part of a clinic is the doctor. And they cannot afford it because there's not enough patients to support a doctor. Say that the town where Orlando lives, what was the name of the town again?
Well, the town's name is Bracketville, Texas, but it's in Kinney County, Texas, and we don't have a physician. And
Okay.
so that's what's interesting to me is I'm glad you went down that path. Can you simply hire a PA to staff the clinic?
Even better. You can do that, but even a PA is really expensive. So what we do is we hire the PA, and in the clinic in Bracken, you can put a medical assistant there, a highly qualified medical assistant who can speak both languages. And that medical assistant will present the patient who is at his or her side to the PA or the doctor who's remotely located. So if we can't even afford getting a PA there, get a medical assistant there, and we can implement telemedicine in that small town and beam into a big city PA or a doctor and get most of the benefit. It's not 100% the same. I'm not going to lie and say it's the same. It's not. But it's 80% the same. 80% of the problems that you have can be dealt with locally, right there. And instead of taking 30 patients a day to support a big doctor in his practice and all that, 7 patients a day to break even. And that clinic can survive and treat the local people, and it just brings it to people's backyard. It brings it to where it's needed, down in the trenches. And you asked the question, Andrea, what is the percentage of Latinos? 98%.
98%. This is big.
Yeah.
And so saying that, doctor, I wanted for you to explain briefly what we're talking about in Spanish, because that number is very important and that number is huge. So we need to explain this in Spanish for our community to understand, and for our community knows that this is available for them. Expliquemos un poco en español qué es la telemedicina y los impresionantes números. 98% de la población latina está utilizando hoy en día la telemedicina. Están estas clínicas ubicadas en Texas, en ciudades como San Antonio, Pasadena, Houston y también en Dallas. Sin embargo, se han ido expandiendo poco a poco a zonas rurales donde ni siquiera hay un doctor que los pueda atender, pero gracias a esta tecnología que empezó o se expandió hace 5 años y ustedes son prácticamente pioneros en esto, han podido que estos pacientes tengan acceso a medicina. Entonces, expliquemos un poco eso en español, doctor.
Perfecto, sí. Quiero aclarar algo que no es que el 98% de los hispanos utilicen nuestro servicio o la telemedicina, pero de los que utilizan nuestro servicio,
Son 98%.
98
Correcto.
son hispanos. Y esperamos que el resto también lo utilicen porque es conveniente y es económico. Y cuando se necesita algo encima, se puede referir a la emergencia o al hospital o al especialista, como se necesita. Ahora, la telemedicina es un encuentro entre un médico y un paciente desde lejos, no en el mismo cuarto. Y el doctor, y puede ser que el doctor está medio jubilado y no puede trabajar solo 4 horas al día, y los otros 4 horas al día, y digamos, por ejemplo, el doctor, 80 años, conoce todo el pueblo, y quiere a todos, y todos quieren a él, y no quiere dejar de trabajar, pero no puede trabajar 8 horas. Entonces, los otros 4 horas de su casa puede ver los pacientes por la telemedicina. Y no solamente por video, ahora por teléfono durante el COVID-19 y quizás en el futuro también. Pero también la telemedicina de Family Practice incluye otros equipos, otras herramientas, el esteto que el asistente puede poner sobre el corazón del paciente, el doctor de su casa
Puede escucharlo.
puede escucharlo. Y un fibro óptico, donde puede mirar dentro del oído y ver el tímpano. O la garganta y ver las anginas, las amígdalas. O una uña encarnada del dedo gordo del pie y el doctor quiere decir, no tiene que quitarlo, o sí, se debe quitar. Ponle una cita para mañana y yo voy en la mañana para quitarlo. Entonces, decisiones médicas se puede hacer desde lejos y económico y rápido.
Algo importante que estábamos hablando en inglés, doctor, el hecho de que muchos hispanos no tienen acceso a seguro médico. Y esta es una alternativa muy importante para ellos porque no solamente pueden acceder a un doctor a través de esta tecnología, pero además es más económico.
Correcto, sí. Hay muchos que no tienen seguro. Tratan, pero no alcanzan de conseguir seguro o tienen poco seguro. Un precio de $30 generalmente es más barato que un copay de un seguro. Y generalmente es el precio de una visita de doctor. No es gratis, pero porque se usa la tecnología, se puede rendir cuidado médico de una forma más económica a todos. Y el precio se pasa a los hispanos, a los pacientes mayormente.
Doctor, en tiempos de COVID-19, las cosas vinieron a cambiar las reglas en todo, porque la necesidad aumentó, la necesidad de podernos comunicar a la distancia, algo que no estábamos muy preparados para esto. Entonces, ¿qué hizo el gobernador Greg Abbott de Texas en cuanto a este tema?
En cuanto a
permitir.
A permitir, ok. Ya permitió.
Había permitido, ¿no?
Ya había
Antes.
permitido y avanzó la telemedicina hace 3 o 4 años, permitiendo que la primera visita pudiera ser por telemedicina, porque antes no se podía en la primera visita. Encima de esto, hace un mes o hace 2 meses, por COVID-19, ya se puede tener la primera visita por puro teléfono.
Sin necesidad ni siquiera de video.
Si no hay video en la casa, el paciente no debe sufrir. No puede sufrir el paciente por no tener tecnología en su casa.
Claro.
Entonces, por puro teléfono, puedes llamar a su doctor o llamar a la clínica y la clínica hacer un triple por teléfono con el doctor y el doctor puede decir, ok, María, yo entiendo su problema, vamos a empezar su cuidado sobre lo que tiene. ¿ok?
Ujú.
Si es algo que requiere una visita física, se puede poner una cita. Si es una emergencia, el doctor seguramente va a reconocer y decir que tiene que ir al hospital. Pero la mayoría de las cosas no son emergencias.
Usted estaba hablando de un porcentaje grande, ¿no? El 80% de las visitas al médico se pueden evitar tener que ir a un hospital o evitar tener que ir a una emergencia, se puede hacer a través de esa tecnología.
Correcto. Y también porque la enfermera o el asistente médico hace todas las preguntas antes de hablar con el doctor. El doctor puede conversar con más pacientes durante un día si es necesario. En el COVID-19, cuando hay pocos doctores, el doctor puede alcanzar a más pacientes porque la mayoría de las preguntas ya se hizo. En la presentación se presenta rápido y, y si el doctor tiene otras preguntas al paciente, sí lo va a hacer, pero si no se necesita, no tiene que ser.
Así que Orlando, mira, a ti que te encanta vivir en estos lugares bien aislados, en Montana y en el otro pueblo que nunca me acuerdo cómo se llama, pero que es en Kinney County, tú puedes quedarte allá y poder tener acceso directo a los doctores.
Pues claro, y impresionante que el doctor habla mejor español que yo. Yo no sé qué tienen en el agua en Beaumont, pero sí saben hablar español. Así que te felicito, doctor, por el español. Pero lo importante que creo que nuestros participantes sepan es que yo creo, en mi opinión, y usted corrígeme si no estoy correcto, es que en la medicina lo importante es el diagnóstico, la intervención y el tratamiento, porque si eso no ocurre, la situación se pone peor. ¿Es correcto?
Correcto. Y la prevención, sí, como usted refirió antes, pero diagnosticar y formular un plan de tratamiento, lo que usted dijo, estas dos cosas son decisiones del médico licenciado o del nurse practitioner o del PA licenciado. ¿Qué tiene usted y qué podemos hacer para ayudarle? Son las dos preguntas en lay language. La asistente no debe hacer de estas dos cosas. No debe hacer el diagnóstico ni tampoco decir si necesita puntada o no.
Okay.
O cuál es el medicamento que necesita el paciente. No permitimos que los asistentes hagan eso, pero presente el paciente en una forma eficiente y adecuada y el doctor desde lejos puede hacer el diagnóstico y el plan de tratamiento. Y si necesita más información, él va a saber, necesito saber poco más para hacer el diagnóstico. O puede ordenar otros exámenes, un rayo X, un laboratorio, para adelantar el diagnóstico o expandir.
Doctor,
Doctor, una pregunta aquí. Por ejemplo, yo ahora estoy en un sitio donde no hay un médico cerca, ¿no? Si no me siento bien esta noche, vamos a decir que me da una fiebre y un dolor de cabeza, ¿cómo me comunico con las clínicas de ustedes que son virtuales? Díganos eso. And the question is in English, for those that are watching, is, as you can tell, I'm out here in a rural area. So tonight, if I develop a high temperature, a headache, I'm not feeling well, how do I access your virtual clinic?
Okay, so Pajardo is, I really facilitate other virtual clinics. Facilito otras clínicas virtuales. Y si usted llama un número central que tenemos.
Aquí lo tenemos y lo voy a dar. This is the number that people can call. It's 1-844-725-2736. 1844-725. Oh, that's the fax. That's the fax. So here is the number, no? 832-808-9100. That's the number that people can call.
Sí.
So 832-808-9100. And I'm going to put it in the comments. That way people can have, in case that you guys need to know where are located those clinics. So again, the number is 832-808-9100. 832-808-9100.
Yeah, but here's my question. My question is, can I log on and contact you? In other words, do I have to call first, or can I just log on onto a website and contact somebody?
You have to call first for now, but we're working on that website. It will be here in about 6 months or less. But for
So
now,
run me through the procedure, doctor. So tonight I have that headache and the fever. I called the 832 number that I hope Andrea will repeat.
okay.
What happens then? You'll give me a link to a virtual meeting?
Typically, it would happen to people that are in Texas, but maybe they're vacationing in Montana. Okay, so if it happens, we would say, what's the clinic closest to you that we service? And we'll connect you with that clinic. We may do a three-way. And then you would be visiting with a highly skilled medical assistant, highly trained medical assistant. That's the best way to say it. And then they would three-way present you to a medical doctor. And that doctor would make a diagnosis. And if there's a prescription, he would call it in, or we use electronic prescribing. So we would e-script it in to the pharmacy of your choice. Could be a CVS or a Walgreens or a Walmart pharmacy that's near your home that you say. Could even be up there in Montana, but certainly could be here in Texas. And that's how it would happen. You call the number, talk to the medical assistant there, and then that medical assistant would three-way you to the doctor and get the
Okay, so what's
diagnosis.
critical here is that you have to have a presenter, whether it's another physician, a PA, or a medical assistant.
Right. It is not absolutely required to do that. I mean, a doctor can talk to his patient if he wants to, but because there's just simply not enough time for the doctors to talk to all the patients, we use presenters. We insist that the presenters intercept the calls and give the skeleton presentation, the most important things. And then if the doctor needs to know more, he will ask.
Gotcha.
But it's essential for our efficiency factor for a presenter to present the patient to the remotely located doctor. Voy a decir en español que es esencial que un presentador hable primero con el paciente, encontrar la información más importante y presentarla al médico distante. Y si el médico distante quiere saber más para hacer el diagnóstico y el plan de tratamiento, así él puede hacer las preguntas directamente al paciente en este momento, pero ya tiene la mayoría de la información. Yo creo que este contestó. No, did that answer your question?
Yeah, it did. I was just wondering what the procedure was because, see, I was under the impression that tonight I could just log on and pop up would come Dr. Packard or one of his assistants, but I understand the procedure now. You will send me to a local clinic in my community. And one of the things I want to share with you, particularly down in South Texas, is a lot of folks, because of a lack of a physician on the United States side, we're so close to the Mexican border, a lot of our folks are forced to go down south of the border and go visit Mexican doctors and Mexican dentists. So this is fascinating to me that we could have a U.S. trained, board certified physician in rural areas. And I'm excited about that.
It's a beautiful thing. And we're getting to where we will have that website where you can log on and talk directly to your doctor. Some other companies such as Teladoc, they have that already, but they don't have the local sites yet where if the patient needs to go have a stethoscope put on his chest, he could do that too. That's where we mostly are, in that world where you go to your local building, it's brick and mortar, and you can get a light shined in your ear or down your throat, or a stethoscope on your chest. But if the patient's far away and just needs a conversation with a doctor, we are able to do that. Other companies only do that, such as Teladoc. That's really what they specialize in, that kind, just phone conversation, no diagnostic tools.
All right. Well, listen, I want to say thank you. I know we're coming up to an hour here pretty soon. So I'm going to let Andrea ask some questions. I know she's monitoring. She may have received some questions from our participants through Facebook. But Dr. Packard, I look forward to visiting with you when I get back to Texas. And I want to thank you for your time. And Andrea, I'm going to toss it back to you.
Thank you, Orlando.
Yes, pretty much, doctor, not many questions, but a lot of comments that congratulations. Somebody from Quemado, Texas. Do you guys have a clinic over there?
Not in Quemado.
Well, he
but
said,
we need one.
Okay, I think, I think they need it because he said awesome. Like it's really it's important for little communities to have these services. Somebody else, it's a felicidades, doctor. Somebody else said hello from native Texas in West Virginia. Oh, no, no, no. She's in native Texas and she is in West
She's in West
Virginia.
Virginia.
And he is. It's Arturo Gonzalez.
Okay.
So he is
Hola,
saying
Arturo.
hi, Arturo Gonzalez. Well, gracias.
Gracias.
Well, thanks everybody for connecting. Well, this is fascinating, doctor. You know, something that we didn't know is very important to be informed and to know that these technology and these services are available. And to the last question for you before we jump on to invite people to connect to our webpage and an important event of education that we have tomorrow. So how did you see the future on the telemedicine after now during COVID-19 and after COVID-19?
Well, that's I really believe that this has established a new vision on telemedicine. Everybody thought it was futuristic only for many years, and then we started it 5 years ago on a bigger scale, and other people have jumped on it, on the boat, but not everybody. And then all of a sudden, social distancing, stay at home, be safe, came into our lives, and we were not.
And the doctors has to close the doors on the offices, and
It was amazing because now telemedicine was thrown on everybody. All of a sudden, many people were not prepared for it.
Nobody.
It's here to stay now. It is never going to go away. It's like the internet is here to stay. The internet will never go away. We will always have sickness in the world. We will always, thank goodness, have Hispanics in our community. And I'm grateful for that. They bring a very important part of the culture to me personally and to everyone. It's part of our history. And we're able now to economically render the help to them in a adequate, it's nothing is as good as in person, okay? Nothing is as good as a conversation in the same room where you can give somebody a hug or pat them on the back or shake their hand. But this, in a time of crisis, when there's not another way, this is a good second best. And it fits the need now, and it has fit the need many years. Now, I forgot to mention earlier, they will always ask you when you go to the clinic to sign some consent forms. Consentimiento, siempre
to be under HIPAA, ¿no?
To be under HIPAA, and un paciente tiene que firmar que es un consentimiento para hacer su cuidado médico por medio de la telemedicina, y siempre tiene el derecho de pararlo y terminarlo si no
quiere, si no se siente a gusto.
So it's not forced on anybody. It's just an option. You can choose to do that.
And another thing, doctor, you think that little by little insurance companies going to start accepting these services, this kind of technology?
I forgot to tell you, I'm so excited about this part. At the same time that they changed the law to allow the first visit to count as the establishing a doctor-patient relationship, that same law required insurance companies to accept telemedicine visit and pay for that the same as any other regular visit. Well, the insurance companies were slow to accept this. They were not accommodating.
Shocking.
Now they are. They're getting better. They're starting to. The answer to your question is yes. The insurance companies are accepting this now as mainstream.
Oh, very good.
Mainstream
very
medicine.
Good. That is an awesome news. And I think, you know, in time of crisis, as you said, doctor, at the beginning, we are the uncertain, that we don't know what is going on. We don't know what is going to happen. So everybody start in panic. But little by little, we are being learning how to live in the new normal. And a beautiful and amazing, exciting things are COVID-19 are bringing to the world and to us.
It's a time of purification, of hitting the reset button, and it's waking us all up, showing us that we're all equal. And to this virus, there are no borders. The virus has no passport.
Yeah.
It just comes the way it is. So causes us to think about a lot of things. Maybe we can learn a lot from it.
Totally.
Mm.
Orlando, I think I wanted you to explain what we're going to have tomorrow because talking about information education is important for our community. And because of that, the Texas Latino Conservatives has a telethon hall tomorrow about education at 4:30 p.m. It's 4:30 tomorrow, Thursday, May 7 at 4:30 till 5:30. Here is the number on the screen, 888-652-0386. Orlando, can you explain a little bit more about this telethon hall in education?
Yeah, just like COVID-19 has changed telemedicine and the way that you communicate with your doctor, your physician, your physician assistant, or your medical practitioner, so it has affected education in Texas. We all know that there's been a suspension of classroom activities and everything's moved virtually. This has put a strain on school districts, on teachers, on superintendents, but most notably, the strain is on the parents, the family, and the students. And so what we have for tomorrow is a fantastic teletown hall meeting, similar to the first few that we did, where we had tens of thousands of Texans participating, asking their questions of professionals. And so tomorrow we have the superintendent, I believe, and I don't have my notes with me, from the Dallas Independent School District, Dr. Hinojosa. We also have a rural superintendent from a great school district down in Bracketville, Texas, and that's the superintendent Munch, I believe. And we also have a school principal that's been involved in education for more than 20 years from a charter school in Houston. So this is a teletown hall where every Texan has the opportunity to participate. You simply log in by dialing 888-652 0386 at 4:30 p.m. It'll last for an hour, but we welcome your calls. We will have call screeners, and then if your call's accepted, you will be live on the teletown hall to ask the superintendents and teachers and principals questions about the future of education in Texas. And I want to say really quickly that I do appreciate the time that these superintendents and principals have dedicated to this teletown hall tomorrow. I know they're extremely busy right now, but it is generous of them to inform fellow Texans about what's going on in education during this time of crisis. So I hope that you'll tune in tomorrow, 4:30, and we'll see you then from Montana. I look forward to hearing from our superintendents.
And also, I want to add something. This Telethon Hall is going to be bilingual. Quiero agregar que este Telethon Hall o este banco de llamadas que tendremos mañana en el Texas Latino Conservatives va a ser bilingüe. Usted va a poder hacer sus preguntas tanto en inglés como en español. Tendremos un superintendente, tendremos expertos en educación, porque si vamos al futuro de la telemedicina, también la teleeducación ya llegó aquí durante COVID-19 y no sabemos si llegó para quedarse. Sabíamos que ya existían cursos en línea, sabíamos que ya existían algunas personas que se podían graduar en línea dependiendo de qué decidieran estudiar y a qué universidad decidieran asistir en línea, pero COVID-19 mandó a todos nuestros hijos a la casa, mandó a todos los estudiantes a la casa a que se educaran en línea. Eso ha sido un proceso difícil, un proceso de ajustamiento para todo el mundo. ¿Estábamos listos o no? ¿Los distritos estaban listos o no? Eso, yo creo que esa respuesta la vamos a tener al final de cuando ya terminen las clases de estos chicos y ellos se den cuenta de cómo este experimento les enseñó cuáles son las necesidades que tenemos en educación, y precisamente parte de eso es lo que vamos a hablar mañana. We're going to talk tomorrow, we were talking about telemedicine today. We're going to talk about teleeducation also. That's a very important topic that we're going to talk tomorrow in our telethon hall, because COVID-19 came to changes everything, every aspect of our world. And one of those was the education. They sent all the kids to the house to try to educate or to send them the education online, and we don't know what is going to be the results, who was ready, who wasn't ready, what was the mistakes, what was the things that they learned, and how they can improve. The tele-education is going to stay here forever, or how it's going to work this, little by little. That's the future. We don't know how many years, but definitely COVID-19 taught us so many things that we were
And
not
Andrea,
ready
I've got to say, Andrea, that it's going to be a fascinating discussion tomorrow to understand the difference between an urban public education experience like in Dallas and a rural public education experience, because the chances are that the Dallas County or the Dallas Independent School District is probably a little more digitally connected, let's say, than rural areas like Brackettville, Texas. So it's going to be a fascinating discussion.
Yeah. So we want to invite you guys tomorrow at 4:30 till 5:30. It's going to be 1 hour in a telethon hall education. This is bilingual, and here we have the information on the screen. Thursday, May 7th, tomorrow, Thursday, May 7th at 4:30 till 5:30. And the number to call is 888-652-0386. And you're going to be able to make your question in English and Spanish. In the meantime, visit our website, texaslatinoconservative.com, texaslatinoconservatives.com. Also, like us on Facebook and Instagram and also Twitter. We are in all the platforms. Visit our YouTube channel. You're going to have all the informative videos that we've been doing since we start our Facebook Lives and the Telethon Hall, and everything that you need in English and Spanish about COVID-19. You're going to find it in our webpage. We have just a page dedicated to COVID-19 information for our community in English and Spanish, and all the help available for the government at all levels, which is local and state and federal levels. So saying that, well, Doctor, thank you so much for your time.
Thank you very much for having me.
We
here
learned
today.
so much today. It's amazing, everything that is going on. And we we knew it's something about telemedicine, but not really. So this is fascinating.
It's just here to help the community where it's most needed, where people don't have the resources. And we just try to be here to help because we've been helped a lot too. So thank you for having me on the show today.
Thank you, Doctor. And well, Orlando, saludos hasta Montana y desde Montana.
Take care, Orlando. It's good to see you again.
All right. Well, bye-bye, and thank you very much for joining us today. See you tomorrow in the Telethon Hall, and see you next week, next Wednesday, for our another weekly Facebook Live. Bye-bye.